Okay, well, we're gonna get started. Thank you everyone for attending today's Michael M. Davis webinar. For any Star Wars fans out there, may the fourth be with you today. In a moment, GFAP Faculty Director and Crown Family School Professor Colleen Grogan will offer brief opening remarks and an introduction of today's presenter, Crown Family School of Social Work Policy and Practice Professor Julia Henly. If you have any questions, please type questions into the Q&A pane or the chat function, particularly if they are a clarifying question for a slide. We'll do our best to answer those in a timely fashion. Otherwise, we'll answer most of the questions towards the end of the presentation. A recording of this webinar will be available on the CHAS website, which is chas.uchicago.edu, as well as the YouTube channel. And now Colleen Grogan will introduce today's presenter.
Okay, thanks so much, Keith. It's a pleasure to be here with my good friend and colleague, Julia Henly. She is a professor in the school, the Crown Family School. I'm looking at Julie's bio and it says the School of Social Service Administration. Uh-oh. Not to owe you, we're all facing that where we still need to do the switch over. Yeah. Julie Henly is a professor in the Crown Family School, as Keith already said. She chairs the PhD program and co-directs the Employment, Instability, Family Wellbeing, and Social Policy Network. I think we are very, very fortunate to have Julie here with us today because she is really the national expert on child care subsidy programs. And although it seems to us in the healthcare field fairly new to be thinking about what we call the social determinants of health, for Julie, this is not new. This is something she's done for her entire career, really thought about the importance of childcare for low-income families, as well as different childcare supports, I guess, again, what we might call wraparound services. These are things that are really important to low-income families, and Julie's been thinking about this for a very long time. So it was also, I think, natural for her to kind of think about when the pandemic happened, what impact does this have on caregiving practices and managing financial uncertainty, as you can see on the slide. That's the title of her talk. So this is new work, as those of us who are looking at the impact of COVID, we know, of course, this is new work, but very, very topical and really important. Obviously, many of you probably also know that given Biden's proposal, there's a lot more money for childcare and childcare credits. So the importance of Julie's work has it's become even more important and recognized at the national level as really important. So there's a lot more I could say about Julie. She's gotten RWJ grants to also recognize the importance of the social determinants of health, and done some really interesting work there. But without further ado, I'm going to hand it over to Julie, and I'm really excited to hear more about this work. So welcome.
Thanks, Colleen, very much. Thanks for inviting me, and thanks, Keith, also for the invitation. So, as the title of my talk suggests, I'm going to share some thoughts on how the pandemic matters for our systems of non-parental care. While there's been a lot of media attention to the monumental parenting challenges that the pandemic brings, especially to caregivers of young children, probably some of you, the implications of COVID-19 are equally significant, I think, for the childcare and early education field and industry as well. At the beginning of the pandemic, many providers were on the front lines caring for the children of essential workers, while others were furloughed or laid off due to program closures. Over the past year, increasing numbers of childcare programs have reopened, and directors are refitting programs to meet new public health realities and trying to stay afloat during the pandemic and onward. Researchers and policy stakeholders have started to accumulate information about the experiences of providers during this period, how their work has changed, and what the longer term implications of the pandemic might be for the childcare industry and the families who rely on it. So together with my co-PI, David Alexander, who's the research director at Illinois Action for Children, I launched a study titled The Childcare Providers Responding to COVID-19 to learn more about these issues. This is an interview study of 76 childcare directors and owners, or owners, sometimes it's both, sometimes it's not, from both centers and family childcare homes. And it explores the implications of the pandemic for childcare programs in 2 regions of Illinois, in Cook County and in a 6-county region downstate that includes Urbana-Champaign and some surrounding more rural counties. The focus of the study is really, we're trying to understand how childcare programs, how directors make decisions about whether to open, made decisions about whether to open or close during the first few weeks of the pandemic, and then how they made decisions about whether and when to reopen. We were also interested in understanding, and from their point of view, the way in which the many programs, government programs and emergency assistance that was offered to the childcare and early education sector, how they experienced applying for that, if they did apply, whether they received it, and what that process was like. And then we were also interested in understanding how providers have been affected, both financially and operationally, with the pandemic, and what their hopes were and their expectations were moving forward. So we did this study, I should say we're doing this study, I'll say more about that in a minute, with support from the Robert Wood Johnson Foundation. And I just want to say how great this was, because we actually had just gotten a grant from RWJ to do a very different study, a study about childcare, but not this study. COVID hadn't happened yet, at least not in the United States. And we really wanted to pivot and still do the study we had gotten funded for, but pivot and do a smaller focused qualitative study to ask some of these questions that I'm going to talk about today. And our program officer, Gina Hajawi, was great and allowed us to sort of redirect some of the funding to launch this whole new study. And so I'm super appreciative of that. And I know David Alexander, my co-PI, is as well. I also want to acknowledge Brenda Eastham and Robert Hughes, who are at the Childcare Resource Service Center at UIUC, who have been helping us with the project, and a whole team of really exceptional research assistants, both at Illinois Action for Children and also at University of Chicago. And you can see their names on the bottom of the screen. So as I said, I need to start with a disclaimer, or at least an update on where we are with this study. When Keith asked me to present at the Davis lecture a few months ago, the month of May seemed very far away, and I thought we would be much further along with this project than we actually are. And so as things often go, too often maybe, we aren't quite where I had hoped we'd be at this point. We just recently finished data collection, and we've really just, literally the last few days, been starting to analyze some of the data. We're really doing coding still of the 76 interviews. So I'm going to use our time today to give you some background on the project and on some of the broader issues that motivated the study, and then share some very, very preliminary findings in quote. And feel free to interrupt. I guess through chat is probably the easiest way to do it. And I'm happy to take questions as I go or at the end, however you want to do it. So, okay. So our outline for today, I'm going to start, as I said, to kind of suggest a little bit by way of background, what some of the problems were facing the childcare and early education community prior to the pandemic. And then ask how the concerns about the pandemic might exacerbate those pre-existing challenges of what I would argue was already a very fragile childcare system. I'm then going to talk about Illinois' response to the pandemic in terms of the public health directives and the government supports for the childcare and early education community. And then I will turn to our study and share with you, as I said, some of the preliminary findings and offer some concluding thoughts. Okay. So let me briefly summarize some of the childcare challenges as I see them, at least, as they existed prior to the pandemic. So for families, the problem of finding stable, affordable, high-quality childcare is a long-standing one. Non-parental childcare is a critical support for working families. Over 3/4 of kids under 6 spend time in childcare while their parents work. These settings include centers and preschools, licensed family childcare homes, after-school programs, informal arrangements with families and friends, a whole host of kind of quote-unquote babysitting unlicensed positions. While a necessary work support for parents, childcare is also an important, or can be an important, developmental support for kids. High quality programs have large developmental payoffs for children with both short and long-term educational benefits. However, quality varies widely across childcare settings, and in fact, studies suggest that most programs are of poor to mediocre quality. And they likely don't then realize the benefits for kids that higher quality settings would. Regarding cost, childcare is expensive. Again, many of you probably know this all too well. Research indicates that formal center-based care is roughly equal to a year of tuition of a 4-year public college. And although family childcare is less expensive on average than centers, it still remains financially out of reach without public subsidization for most low-income families. Moreover, our primary childcare subsidy, which is called the Childcare Development Block Grant Program, I just call it childcare subsidies, covers only about 15% of all eligible low-income children. That's about 1.4 million kids a month, or at least that's what it was before the pandemic. It's gone down. Overall, census data shows that low-income families spend less for childcare than more economically advantaged families, but as a share of household income, families in poverty with at least some childcare expenses spend almost 4 times as much than their non-poor counterparts. That's 30% of their household income compared to 7 or 8% of non-poor families. And if you have been listening to Biden's childcare plans, it's not a coincidence that he's trying to benchmark families' childcare costs at 7%, because this is consistent with what the average non-poor family pays for childcare. Okay. In addition to cost, many families cannot access childcare for other reasons. Centers often don't serve infants or toddlers. They're much more expensive for centers to serve. They often don't serve children with special caregiving needs. And they almost never, there's I think something like 7% of centers are open outside of daytime weekday hours. And so they don't serve, for the most part, families who have non-standard care needs in terms of the hours of day or the schedules that they work. So all of these families with infants and toddlers, families with kids who have special needs, and families who need care outside of certain times of day, they disproportionately use unlicensed providers, family, friend, and neighbor providers. So that's about families. I'm actually not even going to be talking about families today. I'm going to talk about providers. So for childcare providers who are disproportionately low-income women of color, the problem is not one of cost, access, and quality, but it's one of low wages, limited benefits, and high turnover. Childcare center staff have wages that are approximately $11.50 an hour. Those wages are even lower than that for childcare providers of color, for childcare providers who work in homes instead of centers. And 50% of the childcare workforce receives some public benefits, again, pointing to their low-income status. Beyond the frontline staff in childcare programs operate on small profit margins. Revenues from tuition and fees, and in some cases from government subsidies, must cover the primary costs of running a program, which include primarily staff, which is about 60% of a program's costs, facilities, and supplies. So while childcare costs are unsustainably high for many parents, market rates are actually really low from the provider perspective. And childcare subsidies reimburse providers far below the market rate. So most states reimburse providers even below the 70% recommended market rate of the government. So these conditions make it difficult for many childcare businesses to extend their services to harder to serve families, or to invest in quality improvements, such as hiring staff with higher educational qualifications and correspondingly higher salaries, to adopt lower child-teacher ratios, and to enhance curriculum and activities. So the policy conundrum that we were facing, again, prior to the pandemic, was how to build an affordable, high quality childcare and early education infrastructure that serves as a work support to parents, a developmental investment for children, and earns a high quality, stable livelihood for providers. There had actually been a pretty vibrant policy debate about this question or this conundrum before the pandemic hit. And specifically, after the federal Child Care Development Block Grant was reauthorized in 2014 with absolutely no additional funding, there was quite a bit of activity, both advocacy work, research, and other policy work that resulted in several important budget bills that were passed in 2018, 2019, and 2020. And as you can see, we started, this is the Great Recession. We had a blip of stimulus money there, but it went back, right away went back to how things had been. And then you can see starting here, you start to see an increase again in childcare funding. We started to see the federal dollars coming in for new investments in the childcare infrastructure, and then the pandemic hit. So where did that leave us? So I would argue that, I mean, not just I would argue, I think everyone, it's not a hard thing to convince anyone of, that the COVID-19 pandemic has really exacerbated and probably added new challenges to what was an already fragile and complex childcare early education system. There have been several small studies conducted since the start of the pandemic, and I'll share a bit of what we know from those studies before going into my own. But let me first note that the timing of these studies really matters a lot when in interpreting the results. Things looked really different, if you think about it, in March 2020 than they did in late summer, and probably than they do now. And so I think we still don't really know exactly how things unfolded for the childcare and early education community. And where we're at this particular juncture. So as I go over some of these findings, I'll try to think with you about timing, but I think we don't really, it's kind of a problem in reading these papers, not knowing kind of where we are in the run of the pandemic, sometimes when we're talking about the results of these studies. Okay, so let me kind of review what I see as the findings, what we know now. So first of all, there's a fair amount of pretty, I think, hard data to suggest that the pandemic has led to serious job losses and unemployment, well, overall, right, but also in the childcare sector. So the Bureau of Labor Statistics estimates that the childcare sector lost 170,000 jobs in 2020. And as of December 2020, the childcare workforce had shrunk by 17% compared to before the pandemic. There had been a lot of talk and concern about program closures, with people arguing, oh, 50% of programs were going to close. There was a lot of concern about program closures. We actually haven't to date seen the kind of drastic program closure that I think a lot of us thought we might. And I'll come back to this, but I think it has a lot to do with the stimulus funds that have been supporting the childcare industry during this time, which have been really, I think, quite critical. Importantly, centers were more likely to close than homes during the pandemic. But even centers in Illinois, this is Illinois data I'm showing you on the slide here, only 2.6% of centers, or there was a decline, I'm sorry, in 2.6% of centers. There was an increase in 1.5% of homes. If we have time at the end today, I'd love to talk a little bit about what the pandemic means for the home-based childcare sector. I don't know how much I'm going to say in the talk, but I'm very interested in that, and I have a couple studies looking at that right now. Third, the pandemic probably exacerbated or increased program costs for childcare providers. Now, why would that be? If they don't have as many kids, they shouldn't have as many costs, right? Well, reduced capacity means reduced revenue often, and enrollment declines. Well, reduced capacity, what I'm talking about there is both how many kids are in the center or in the program, but also what the stay-at-home order and what the later pandemic requirements were for number of kids in classrooms. So as you'll see in a minute, childcare programs had to reduce their capacity. And on top of that, they had enrollment declines anyways. And so that resulted for some, but not all, lost revenue. I say not all because some people got stimulus funds to subsidize some of that loss. There's also increased personnel costs, and I'll say a little bit more about why that might be, but just briefly, for public health reasons, childcare providers could no longer let teachers move between classrooms or float kind of when a classroom was open to float to that classroom and then to another one. And so there's a concern that providers had to hire, owners had to hire more staff so that they could follow the guidelines. And then finally, there were probably increased public health PPE kinds of supply costs. The Center for American Progress estimates that increased program costs are up by 47% for centers and 70% for homes. Some people think that is too high. That's an estimate, and it's based on, it's paying less attention to any kinds of government subsidies that might have come in to work against those costs. So that it's probably something a little bit lower than that for programs that are getting subsidies. Okay. I'm just showing you this slide because David Alexander gave it to me, and I thought it was nice to look at some real numbers. This is showing that, so Ccap is the Child Care Assistance Program in Illinois. That's Illinois' version of the National Child Care Subsidy Program. So this is showing Ccap enrollment in the last year. And what you see here is for all kinds of care, there's been a pretty big drop in kids on the Child Care Subsidy Program, and especially kids that use centers and non-relative family, friend, and neighbor providers. Family, friend, and neighbor, FFN, is unlicensed home-based care. But what you see is licensed homes, which actually had been declining for years before the pandemic, are not declining as much during this period as they were prior. And relative family, friend, and neighbor care is also not declining as much as the other categories. So again, I think this points to something, a conversation that I would love to have about home-based care if we have time at the end. Okay, back to what we know from some of the research. In addition to enrollment reductions and job losses and increased costs, we also see from some of the more, the survey and the more subjective self-report data from studies that there are surveys suggesting that providers across different states and different samples have had difficulties getting PPE and sanitation supplies. Again, when I look at that data, it seems to be mostly the surveys that were coming out at the very beginning of the pandemic and not as much the more recent ones. There was also concern about poor communication, uncertainty, providers having uncertainty about rules and guidelines, whether they were eligible for a program or not. Again, maybe that was more common at the beginning of the pandemic. I don't think we know. And then there's several studies that suggest really serious food insecurity and financial insecurity, not just among kids and families who use childcare programs, but among the childcare workforce itself. Increases in stress, increase in depressive symptoms, increase in anxiety, and personal health risks that disproportionately affect people with underlying conditions and also with underlying health conditions, and also people of color who are disproportionately facing the brunt of the most serious, as you know, pandemic-related, COVID-related illness. So for all of those reasons, I think we can be worried and maybe want to better understand the health and well-being of childcare providers and the broader childcare workforce. And then finally, there's some work that suggests declining service quality within childcare programs. That work is mostly self-report, as I said, very little observational work is going on right now. And then there's also some work suggesting that children have high rates of anxiety and concern about children's well-being in childcare programs. So this gives you sort of a general overview of an accumulation of research that has been going on for the last year. And I want to kind of use this to sort of place the work that we're doing. So one of the key research questions we ask in our study is how program owners and directors are responding to the COVID-19 pandemic, both from an operational point of view and a financial point of view. So we want to consider these research findings from these studies I just talked about in our analysis of our own interviews. And I think you'll see kind of the kind of questions we ask resonate with these findings and with these questions. Okay. So let's shift now to look more specifically at the federal stimulus and state funding efforts that are being targeted at the childcare and education sector before we move on to the study that I want to focus on. So with the support from federal stimulus dollars, $3.5 billion in childcare development block grant discretionary money came through the CARES Act last year, and an additional $10 billion came with passage of the year-end December pandemic relief bill. States created with these dollars all sorts of different streams of relief for childcare programs. It looks kind of different in all states, in every state. But in the case of Illinois, at least, we loosened eligibility requirements for childcare subsidy for providers to get access to childcare subsidies. We simplified application processes, and we increased payment amounts to subsidize childcare providers. This childcare stabilization effort continues with $39 billion in dedicated relief for the childcare industry as part of the 2021 American Rescue Plan. And I don't know about you guys, but I always have trouble, like, is 39 billion a lot or a little when you think about these things? It's kind of hard to know. Well, in the case of childcare subsidy, it's huge. We haven't seen an infusion of resources like that really ever, or at least since the welfare reform law in '96, when the CCDBG, the childcare subsidy program, was put together. So this is a huge amount of dollars going to rescue or stabilize the childcare industry by American standards. And as I said, states have a lot of discretion in how they use their dollars. So what did Illinois do, or what is Illinois doing? I made this little table. It does not cover everything. And I should probably give a shout out to Allison Zindel, who is currently working for Office of Childcare, but was a research assistant this summer, because she and another student, Betty Shukri, really looked at all the assistance that was out there and tried to categorize it into different types of programs, and it was really quite helpful. So I kind of narrowed that down to just this table with 5 rows. So first thing to just remember, you probably remember this, March 21st, 2020, Governor Pritzker announced the stay-at-home order, and that with that announcement, all childcare centers and homes were officially closed. If a childcare program wanted to provide childcare assistance to essential workers, they had to fill out a form declaring themselves an early emergency childcare center. Homes had a slightly different process. And it was supposed to be really easy. And I actually think it maybe was really easy from the little bit of research I've been doing, sleuthing through the interviews. It seems like the emergency childcare form that you had to fill out was pretty simple. And then you could keep providing care, but only for essential workers. By the end of May, all providers were permitted to resume operation as long as they were in compliance with the emergency rules that were related to proper sanitation, PPE, social distancing, and various other public health measures. Part of this was that no child care center could operate above 30% capacity. Another thing Illinois did that I think is really important to think about and really relevant for the revenue question is it adopted what's called the Ccap attendance waiver policy. And what that policy did is it allowed programs to keep receiving childcare assistance payments from the government, even if the families that use their program weren't attending. So it usually, in a non-pandemic world, a provider has to let the childcare subsidy office know what their attendance is, and then they get paid. It doesn't have to be 100%, but they get paid based on their attendance. What the Ccap attendance waiver did for a pandemic was it kept paying programs what they would have normally gotten based on the number of kids they served in the childcare subsidy program, whether or not those kids were there. So that was a really big subsidy and helped programs stay afloat, we think. during that first part of the pandemic. Now, as I understand it, the Ccap attendance waiver expired in July. One of my research assistants can correct me in the chat if I'm wrong, but I think that it expired in July. There were 3 other programs just really quickly that I want to talk about. There was a one-time stipend early on in the pandemic that childcare providers were eligible for, and most received, I believe. It varied in amount based on type of care and size of program. And it was meant to defray the costs for opening your program to essential workers. Probably the most important, well, Ccap attendance waiver and the childcare restoration grant are probably, I think, the 2 most important grants for, unless you got a big loan, for providers during this time. And there were 2 rounds of childcare restoration grants. They were paid for through federal stimulus dollars. And they were provided to businesses that could demonstrate through the application process that their business was interrupted, the revenue was interrupted due to the new licensing guidelines. So you had to show that you had reduced capacity because of the licensing guidelines that the state changed for the pandemic. And then finally, some providers were able to get PPP, a Paycheck Protection Program loan. Some of you have probably heard about that because it's not specific to childcare. It's a small business loan. That was less common than these other programs, and I think there's several reasons for that if there's time we can talk about later. But much more common was the Ccap attendance waiver for programs that take subsidized kids. That obviously wasn't available to programs that don't take subsidized kids, but the childcare restoration grant was. Okay, actually, I'm going to go back. So this list of programs is useful to think about. I just want to raise one of the big questions that we're asking in our study is how providers experience government efforts to respond to their needs, with particular attention to what's referred to in the public management literature as learning, compliance, and psychological costs that I'm sorry, let me say that over. Providers might report, we're thinking, different kinds of costs to participate in the program. Learning costs, knowing about the program, compliance costs, the kind of administrative burden of applying, and psychological costs, the sort of stress that's involved sometimes in applying for programs. And so we want to ask the question, do these programs have those kinds of costs attached to them? And are they the same as other public benefit programs, or are they different? We're looking specifically at 2 aspects of these programs: the way the state has communicated about the program. So do people understand what programs are available, and also their experiences applying for and receiving them. We're attending, especially in our analysis, to the childcare restoration grant and the Ccap attendance waiver, and the emergency childcare stipends. But we already asked in our interviews about all kinds of programs. So if other programs come up, we'll also be analyzing that data as well. So the one reason why I'm interested in this question, because we know, and I know from other research I've done, that public benefits, I've studied the childcare subsidy program, I studied the TANF program, the old AFDC program, the general assistance program when it was in existence, they all have very high transaction costs for participating. It's a lot of work to participate. And as a result of that, a lot of people either, get discouraged by applying and they don't apply, or they do apply and they ultimately get on, but it's a frustrating experience. So we know that already. Why study that here? Well, Illinois made an explicit effort to simplify the application processes, and they invested heavily in communication with the childcare and early education community through online webinars, through expanded email, through social media blasts, and outreach from all sorts of partner agencies. So I really wanted to know whether all of this made a difference. They changed the forms to be simpler. They advertised in kind of more transparent ways. I want to know whether that mattered and whether it worked. So on the screen, I've kind of talked about those 2. These are our 4 study research questions. I'm going to share some data about the middle 2, and I've already kind of raised them in my talk up to this point. But let me just quickly talk through all 4 questions so you have a sense of the study itself. So we're first wanting to know how childcare programs made this, well, a program doesn't make a decision, how directors or owners made a decision, the decision to stay open or closed or to reopen after closure during the pandemic. And do they have access, or did they have access at the time, to necessary information that they felt they could make an informed decision? And then the second question, as I said, do childcare center directors and family childcare providers know about the emergency assistance available? Are they accessing it? And what are the barriers to accessing it that they experience, if there are barriers? And third, we expect financial and operational challenges to be really pretty severe for this sector. We want to know how are program owners and directors responding to the COVID-19 pandemic? Are they experiencing this exacerbation of financial challenges? Have they changed their operations? In what ways have they changed their operations? We know they have somewhat, but what do their programs look like now compared to what they used to look like? And how have family, staff, and children been responding in their views to the changes? All of this is from the perspective, remember, of the provider, not of the family. And then finally, how have programs experienced the pandemic over time, especially since the stay-at-home order was issued in March 2020? What are their plans moving forward? What are their expectations moving forward about the viability of their business? Okay. So let me move on to our study. I'm going to talk about the sample first. So as I said at the beginning, we're doing this work in 2 regions of Illinois in Cook County, Chicago and surrounding area. This is called Service District Area 6, or SDA 6, by the Illinois Department of Human Services. And then we're looking at Service District Area 10, as I said, which is a downstate 6-county region that includes Urbana-Champaign. I don't know if I said that part before. We're done. We interviewed 76 directors and or owners of childcare programs, 50 in Cook County and 26 downstate. Of the 50 Cook County programs, 25 were centers and 25 were licensed family childcare homes. So we did not interview any non-licensed, any license exempt providers for this study, although I would love to, and I have a plan to do so in a proposal that I'm submitting on Friday. So we'll hope that that happens. We also interviewed 26 downstate, 14 centers, and 12 family childcare homes. We did some purposive sampling. This is not a random sample. We don't want it to be a random sample. We tried to find certain kinds of providers to fill out ourselves as a qualitative study. We weren't interested in representativeness, but we wanted to have a distribution of kinds of providers. So we stratified by childcare type and by whether the program was open or whether it closed at the start of the stay-at-home order. The sample ends up being diverse in other ways in terms of its geography, even within Cook County and within downstate. We try to get a diverse sample. The programs vary by size, by whether or not they have what's called a quality rating, which is a rating that they may get from Illinois Department of Human Services. They vary in how reliant they are on Ccap. What that means is sort of how many of their the density of the number of families that they serve who also receive subsidy versus private pay. So that's another way of measuring whether they have a lower income clientele and whether they're for-profit or not-for-profit status. So this is just briefly a quick table of our data. I didn't do percents, I just did ends because it's such a small sample size. You can see the first column is our centers. Of the 25 centers, they're pretty evenly distributed between whether they were closed or open during the stay-at-home order, somewhat more closed, somewhat more high density subsidy Ccap, and pretty equal on for-profit, not-for-profit. In terms of homes in Cook County, more of them, again, were closed than open, but we still have 10 that were open during the stay-at-home order. Many more high-density Ccap homes. And home-based childcare is almost always for profit. I don't know if we have any nonprofit childcare homes. I'm sure saying that now someone can tell me that we do, but in our sample, we don't. How's that? And then downstate, Of the 26, we have 8 closed and 6 open centers and 2 closed and 10 open homes. We have fewer high Ccap centers and more high Ccap homes. And we have, again, all for-profit homes and a mix of for and not-for-profit centers, but we have more not-for-profit centers. So what was the data collection process? Well, we first did a brief phone interview, a Qualtrics survey with the providers that we were trying to recruit into our study that collected basic demographic and program information. We then followed that up with qualitative interviews, either in English or Spanish, the choice of the provider. And then every interviewer wrote a post-interview memo about the interview. Those 3 pieces constitute the data for the study, but the qualitative interview is the key data source. Each interview was, well, interviews on average were about 60 minutes. They were all done on Zoom. They were transcribed, and then they are being coded in Deduce as we speak. The interviews were fielded, meaning we were on Zoom, from September 20 to April 21st. I think we're still on Zoom. We're always on Zoom, but these interviews were conducted on Zoom during that period. And as I said, we've recently left the field. We've left the Zoom call, and we're starting to code the interviews. And I've read all the memos, and I've started doing some analysis of the interviews, just really tentatively. So as I said, analysis should be thought of as very preliminary, and these aren't really findings, they're more hunches. That makes me feel better. Okay, so I'm going to talk about 4 themes that come out of the data as I see it, specifically related to those middle 2 questions that I highlighted. And these themes are related to financial pressures, the way providers respond to financial pressures, the ways in which they adapt to the public health directives, the governor's public health directives, and then some changes to the curriculum, to their curriculum and their programming. Okay, so we expected financial pressures to be great due to pre-existing fragility of the childcare sector because of steep enrollment drops and because of increased costs. And from looking at the interviews that I've looked at to date, there's certainly some variation across how financially hindered programs are, but many describe their current financial situation to be worse than before, and many describe it as very difficult. Although this is an open-ended interview, we do ask a couple quantitative type questions. One of the questions we ask is on a scale of 1 to 5, how difficult is it? And seems like pretty much everyone, as I went through, were between 3, 4, and 5. But I'll try hard not to say most. I'll say many and not most, because we really haven't done a full, careful analysis yet, so I don't want to misrepresent. Okay, so providers are facing financial pressures. What are they? What are those pressures about? Well, as prior research suggested, we're seeing that new costs related to both public health related issues and personnel are critical. So as an example, this center provider in Cook County says, so I think the biggest struggle right now is that we do need additional funding because we need additional staff. More staff is needed to run a program than before. So before COVID, we could combine classrooms or share teachers and think like that things that we cannot do any longer. And so it's going to cost us more money because we need more staff. There's not much efficiency now to how we can do things. And so more funding to cover staff roles that could be shared, that could be shared before cannot be shared now. So that's the personnel argument. And then this just succinct quote that I think kind of fits many of our providers who were all spending money on PPE for the most part. I wouldn't be spending the money I'm spending on PPE if COVID didn't hit us. And then finally, these are all 3 centers from Cook County. I should have been a little more careful to be more diverse in this slide, but I think I would have seen similar quotes in some of the other areas as well, and with some family childcare providers. This last person says, instead of having parents bring in everything, so parents used to bring in the blankets that the kids slept on and the food that the kids ate. We're buying lunch for all our school. We purchased blankets for all our children, so we don't have to have the blankets come in and out. So these are all extra costs. Revenue is down due to limited enrollment, and I say almost everyone here, and I'm not counting government subsidy when I say this. So just looking at revenue due to tuition payments, revenue seems to be down. So this provider says, I'm down very, very low right now. She's a center. I mean, when I say low, I mean like 14 kids. So, and I still have the same staff and I'm still paying them the same salary and the mortgage. So hopefully we'll get the second childcare restoration grant, because there were 2 cycles of it, because that will carry me through until they pick back up, I'm hoping. This other provider says, parents haven't gone back to work. Some are still at home drawing unemployment. Some is nervous now that COVID has gone up. Some have a sibling that's out of school. The older ones, they're home, so they're babysitting the young siblings, and that way they don't have to, the parents don't have to pay out of their pocket or pay a copay or whatever the case may be. So these directors are talking about losing enrollment because of the pandemic. So how do they respond to the financial pressures that they're facing, the new costs and the enrollment declines? Well, as I've said several times now, and this really is critical, I think, the most important response, I believe, to this pandemic has been the stimulus funding based on so far based on what I've read. So many people said something like this quote: if it weren't for the grant, we would be losing a lot more than, we wouldn't have enough to cover the salaries, to tell you the truth. Right now, the restoration grant is helping us support salaries and to pay the rent. So most of the interviews here, I use the word most of the ones that I've looked at so far report having received at least some government assistance, and they report that business could not have survived without it. Many report the process of applying for government assistance was relatively easy, and the communication from the state was okay or even good, especially in comparison to past experience. So this was one of the questions I was wondering about, and I obviously will want to look at this much more carefully. And I tend to be kind of cynical about these things because I know from my other work and other people's work that public benefits are never easy and they're always complicated, and it's sort of intentional to keep people from applying. But there was a really concerted effort to try to make this an easier process. And it seems like, at least for many providers, it was. I say that to say that there definitely was variation, though, in the experiences. When I read through the interviews, some people did talk about a frustration with waiting for the approval of the application. Some people talked about not getting any response when they called to ask for help. Some people found the applications confusing. Some people didn't find them confusing at all. So we want to try to understand this variation then as we move forward with the analysis. Why is it that some people, what's different about the people that find things confusing and that don't? I see that Colleen just sent me an email that says there's some financial questions in the Q&A.
Do you want me to ask
Julie,
them?
I don't think you have to answer them now, though.
Okay, all right.
That was my sense. I did
Okay.
read them.
I'll come back.
I think you can hold off till the end.
To it. Oh, one of them's from Erna. Hi, Erna. Okay, so we'll come back to those questions. Let me just go to the next response to the financial pressures. Several people whose interview I read talked about either they, or in this case, we were talking to the director and she's referring to her owner, paid personally out of their own savings or their own money to get stuff for their program rather than their regular program budget. So this person says the owner pretty much paid for everything on her own, out of her own pocket. Like she was buying masks for the kids and the parents to put on when you come in, the gloves, the sanitation, I mean, the hand sanitation and things like that, like pretty much all the PPE gear. This was a downstate participant. People also talked a lot about responding to the financial pressures by relying on donated supplies. These could be from the government, but they could also, and often were, from nonprofits, from foundations, from individuals in the community. it was fairly common for parents of kids to bring in PPE related stuff for the program. We have one, we might have more than one, but we have one the interview that we just analyzed of a childcare center in a hospital. And she felt really lucky because her parents were often worked at the hospital and they were able to get her PPE. And then another response to the financial pressures of the pandemic has been to shift the population of kids that you typically use, so that we have several examples of providers who might not have served school-age kids before, or maybe only served a few school-age kids, and now have expanded their care to a school-age population. And I'm going to come back to that in a minute because it's related to another theme that I want to talk about later. Also, people obviously had to refashion in the early part of the pandemic their focus on essential workers who they may or may not have been focusing on earlier. Okay, so now I'm shifting to the third theme about adapting to public health measures. Providers really had quite a bit to say about how they are adapting to public health measures. As you can imagine, this is like front and center and what they do every day. And these comments had to do with their ability to access PPE and sanitation, their strategies for trying to get enough, ordering in bulk when they could, relying on parents, as I just talked about. Challenges with access came up a few times, especially in the interviews that we conducted earlier. Providers talked a lot about the importance of training themselves and their staff. I was really kind of impressed how much providers talked about listening to all the COVID related trainings and webinars that the state had put out, and asking their staff to look at them or reporting to their staff about them. All of the providers had to, by law, adapt all sorts of new procedures, both for parents and for kids. And so there's new and complicated drop off and pickup processes, which is really hard for parents, especially as one provider said, for new parents that are just starting to use the program. They've never been inside the program before, and they have no idea what what kind of place we are because they're not allowed to come in. They had to change the way they do meals. I gave you that quote before about the blankets. They also, several people said they use email so much more than they used to, both to communicate with the state and also to communicate with parents. And then, of course, all the new social distancing and mask wearing and hand washing and sanitizing and less touching that goes on in the classroom. So all of these kinds of changes to adapt to public health measures can affect the programming and the curriculum. And I just want to give you two examples because I thought they were kind of interesting. This first one, at first I didn't think much of it. And the more I thought about it, I thought it was actually concerning. So she says her cleaning practices changed the availability of her activities and her toys. And she says, well, my sanitation practices have definitely changed. I sanitize twice a day now, and I don't bring all those toys out at one time. So I just rotate the toys out and I sanitize twice a day. And I was thinking about that and thinking about the kids in the classroom and what that means for the kind of engagement and curiosity and complicated stuff to do in the classroom if you've restricted what's in the classroom. I'm not at all trying to say this provider shouldn't be doing this. Of course, this makes perfect sense that she is doing this, and she might be doing it in a way that's not affecting the children's well-being at all. But I just started to think that these practices really are streamlining then what's available in the classroom for kids to play with. And then the second example, this person talking about having to give up activities like field trips. And she said, we've canceled all our field trips because of COVID. We canceled all of our birthday parties. We canceled everything we normally used to do because of social distance. We don't do it any longer. No taffy apple sales, none of that. Kids can't go to the pumpkin farm anymore. I mean, it's been a hardship on all of us, including the children. Okay, so finally, I want to talk about changes to programming and curriculum. And there were a lot of these, and I really just want to talk about two that are both related to e-learning and remote learning, because I found this interesting I guess not surprising, but still kind of interesting. So there were many examples of how programming and curriculum have changed, as I suggested. I just am going to focus here on these two areas. So what I'm calling e-learning here, extending care to school-age kids to help them with school. So this center director says, right now we're trying to help some of them, our parents, with the e-learning. We have some e-learning students, so that's very time consuming. So we're trying to help them so they can go to work, meaning the parents can go to work. In several interviews, providers that are setting up e-learning environments so that they're using school age, they're serving school age kids and they're using a classroom or an area of their house, if it's a home, to set up computers so that the kids can be in class. They talk about extra costs to purchase chargers, to update their internet, in some cases to actually lend computers. They talk about new expectations on them. One, I didn't put this quote on because I thought I was going to be running out of time, but one provider talks about how some of her parents expect the homework to be done at the end of the day, and she doesn't have time because she also has classrooms with little kids to help with homework. And so it's creating stress between her and parents around homework expectations. And similarly, this is related, talks about interrupting programming between the younger kids and the older kids. There's just more interruptions with this e-learning. But other people talked about it working quite well. There's one provider that has actually totally expanded her business. She has 17 school-age kids. She doesn't have as many younger kids anymore because she's sort of preferencing the school-age kids now. So there's variation. And again, we'll want to understand that variation in our analysis. And then finally, the other kind of remote learning that I want to talk about is the work that childcare providers did when they were closed, or even when they were open, when their regular kids weren't coming, to try to keep their kids engaged in childcare. So in this first example, this center director, the interviewer says, are you still continuing to do remote engagement with families who aren't attending? They apparently talked about it earlier in the interview. And the provider says, yes, we are. So we're doing remote learning. Families are able to log on to Zoom, classroom activities, and participate that way. We also utilize Ready Rosie. So it's a tool that has some e-learning options that parents can use pretty easily with their children at home. We use that as well as with our own programming. And then the second quote here, yes, I do, or yeah, I do remote learning. A few of them over the phone. I would call and we would FaceTime and sing and stuff, but I feel like the parents kind of got annoyed with that. So I was like, okay, before they left, I made them some little packets with flashcards, left because they were pulled out of the program. And all the things that we do during circle time, that was all sent home with them. So hopefully they did that with them, meaning the parents did that with them. Yeah. Okay. So we have a lot more to do, and this was just obviously descriptive illustration of a few of our quotes. We have to complete the coding and the analysis. I am really interested in how homes versus centers are responding to the pandemic, and whether homes, I'm wondering, might be more able to adapt in ways that are comfortable for parents and also may be safer. I'm also interested in looking at other comparisons. I'm interested in looking at the high Ccap versus the high private pay programs to see how they experience things differently. The high private pay programs may very well have more savings to fall back on, but they're not eligible for some of the subsidy related benefits. And then, as I said, I really want to tease out timing. We wanted to do these interviews all close together, but it just didn't work logistically. And in a way, I think it might be a good thing, because if I can actually try to put on a timeline when the interview was done, I might be able to see some change, some patterns and some change. As I mentioned, we're writing a proposal, David Alexander and I, to Washington Center for Equitable Growth to do a qualitative interview with unlicensed family childcare providers, as well as to do second interviews, follow-up interviews with the family childcare providers that we interviewed in this study. So hopefully we'll get that funding, and if we don't, we'll find other funding to do that study. Okay, so in conclusion, The pandemic draws renewed attention to the critical role of childcare for a healthy economy and also for gender and racial equity. It underscores financial fragility of the childcare and early education system, as it has created enormous pressure on the low-wage childcare workforce and the poorly resourced childcare infrastructure more broadly. So I want to return to the policy conundrum we started with, how to build an affordable, high-quality childcare early education infrastructure that can do all three of these things, that can serve as a work support to parents, even parents that have jobs that make them work at 2 a.m, that can be a developmental investment for kids, and that can also be a high quality and stable employment for providers. How do we do that? I don't know, but COVID might be a policy window for more substantial public investment. And I do think if we're going to get anywhere on that charge, we would need to have a much more significant investment from the public sector. As I mentioned, there was an infusion of funds even before COVID, and there's much more with the stimulus. There's a question, I think, about whether any of these investments will be made permanent. Certainly, states are going to have a hard time spending lots of money in the next few years, given the financial situation that they're in. And so I think it's really an open question, but maybe we do have a policy window to move some of this work forward beyond just stimulus. And certainly that's Biden's intention with his latest families plan. So I think research during the pandemic might help move that agenda forward, providing empirical work to demonstrate need, but also to help determine appropriate direction for new investments to take. So thank you.
Okay, thanks so much, Julie. That was really, really interesting. We do have some questions in the Q&A, but I'm going to take my privilege as the moderator and start off with some questions of my own. And I have a couple. One is more, you ended with, will these increases in funding be made permanent? And I know that this is just you kind of surmising, but obviously because you've been in this field and sort of quite familiar with policy changes over time, and likely also the politics around childcare subsidies, I do think it is quite interesting, as you showed us in the beginning with that graph, that funding was really going up during the Trump administration, which wasn't known for being, most of us don't think of the Trump administration as wanting to provide, significant subsidies to low-income families. But this was an area where that wasn't the case. And I mean, I tend to think of childcare subsidies as an area that can really galvanize bipartisanship, although that's happens so infrequently today in our political polarization. But, what do you think? I mean, what do you think this is an area where we can find some common ground and that funding, really is going to continue on the upward trend? So that's my first question. And then I'm going to ask you another one. But.
Right. So I don't know the answer. And I feel like let me just say that the 2008 recession, we saw a bunch of stimulus dollars and then nothing, right? And it just went away. And it went back to we actually, even though the graph looked like things were kind of going up, they weren't really, because subsidy dollars, many states were only using subsidies for centers, and center reimbursements are much higher. So actually the number of kids receiving subsidies kept going down. But then, as you said, we saw this, I was actually in DC for a childcare conference. It wasn't like with policymakers, but there were some policymakers there, but it was just a childcare meeting. And it was the week in 2018, when somehow they passed this bipartisan measure and no one believed it. We're like, how can this be? This can't be. And then it just, it was almost like it almost happened under the radar. It didn't get a lot of press, but it was bipartisan, and then it passed. And so that's hopeful. I think the part that makes me less hopeful is the way the narrative I keep seeing, and there's sort of this new narrative. I feel like we're back in 1970, and women are supposed to stay home now and take care of their, I mean, there's this cycle, right? So with the latest Biden proposal, American Families Plan proposal, there's been a lot of New York Times articles, Post articles, quoting mostly Republicans saying, women don't have to be in the labor market; they can stay home and take care of their kids, as though the Democrat proposal isn't allowing that. Actually, a tax credit would allow that, but anyways, I do worry that the narrative is very intentionally being manipulated now away from women in work or caregiving in work and towards staying home and taking care of kids. And I think this is just, it's used in a very class-based and race-based way, right? Because these are the same people that in 1996 were saying everybody should, everybody, meaning everyone on welfare, should go to work and not be home. So, I don't know that this, I'm not at all saying that this represents some sort of true belief on anyone's part, but I do think the narrative is getting used in a way that kind of will make it more difficult to keep a really heavy investment in childcare permanent. But I think these things are also, I mean, you're the political scientist, not me. I feel like these views are very malleable too. Like, I think they're so subject to framing. So maybe the advocates can find a frame that's effective. I don't know.
Yeah, that's really interesting. And also, sometimes they're malleable, but also the reality of people's lives may really push back on that rhetoric, right? Because you have, many people that voted Republican that, are working mothers. Of course, we understand, you know the statistics better than I do. I mean, it's so that will be very interesting. My other question is also kind of where you ended, which was that you wanted to look at some of these comparisons. And I know you haven't had a chance to do that yet. But I was wondering if you could just sort of motivate, like the arguments for looking at the comparison, or really the other way of saying that would be sort of, what are your hypotheses, sort of why? So you mentioned home versus centers, but I had already sort of jotted down in my notes, like nonprofit versus for-profit. Yeah. And so to me, what's interesting in you saying home versus centers is you had also commented that homes are almost all for-profit. So it really seems like a home for-profit comparison to centers, which are maybe both. But I just wondered, in the healthcare field, the nonprofit status gets very, very messy. It's very interesting with nursing homes as well. Like, all the nursing homes that are for-profit predominantly take care of Medicaid patients, which you wouldn't necessarily think. So just wonder if there's some really strange things happening in the childcare sector around the for-profit status that would be helpful for us all to understand, and sort of what do you think is happening there? What are you expecting? What do you think you might find, even though it's just a hypothesis at this point?
Yeah. So I have to start by saying I am not an expert on this at all. I know that there's a literature out there on this. Similar in healthcare. There's one in childcare. So what I may be saying, I'm not the expert on this. I might say it wrong. My understanding is that for-profit childcare, this isn't quite answering your question, but for-profit childcare centers tend to be actually lower quality on average than nonprofit childcare centers. They tend to be, I'm not talking about home-based, I'm talking about center-based. They tend to be more likely to be chains, I think, than nonprofits. They're less likely, I think, to have rely on mixed funding models, relying heavily on public subsidy. But I'm hesitant. There might be some, I can't see who's on this call. There might be someone in the audience who knows this, and I might be saying something wrong. So if I am, put it in the chat. So I think I would expect the for-profit sector to look really different depending on the clientele that it's serving. That's the other thing I wanted to say. There are for-profit childcare centers in very low-income communities that have very low profit margins, I think, and that aren't going to be doing well, most likely, in this environment. There are also for-profit centers in suburban and higher income communities that I'm guessing have much higher, much greater ability to fall back on savings and to take out loans and to ride this out. And so I'm not sure if for-profit alone is going to be able to disentangle that. And then the home, I don't think it's necessarily the interesting question to look at like home for-profit versus center for-profit, because I feel, I don't know. I don't know. I don't know the answer to that. For me, what's really interesting about homes, and this is partly because of some of my other interests, I've been with Gina Adams at Urban Institute. We've been doing work on kind of trying to understand the decline in licensed family child care over time. And I mean, we actually haven't been doing work to try to answer that question, but we've been concerned, I should say, that the kind of narrative around investing in high quality early education and getting kids in public pre-K and Head Start and early education programs so that they're school ready. I'm all for all of that. That's great. But that kind of narrative, that way of thinking about childcare as we need to replace childcare with early education, that is kind of been coded as we need to move kids out of home-based arrangements into centers. And I mean, it's not kind of, it is. I mean, and there's been intentional efforts to move to incentivize centers over homes. And Gina and I have argued for a lot of years that that is potentially misguided. Not that people shouldn't use centers, centers can be great, but homes can be great too. And that unless centers are going to really change what they do and who they serve, any kind of policy move that only supports centers will leave out, and this is empirical work that we have done, will leave out more than 50% of low-income kids, because more than 50% of low-income kids are not eligible for most centers because centers won't serve them because of their needs. And so I've been really concerned about this sort of, I think, not very thoughtful kind of centers are higher quality than homes. Let's invest in centers and forget about the home and forget about home-based childcare. If you look at the data, on average, centers are, if you believe kind of developmental psychology's measures of quality, and there's a whole contentious debate there, but let's just say that they mean something. I think they do. Centers are on average higher quality than licensed family childcare homes, and licensed family childcare homes are on average higher quality than family friend and neighbor care. But there's huge variation in any of those buckets. And any family, any parent who's looking for a caregiver to watch their kids may not be comparing a higher quality center to a lesser quality family childcare home to an even lesser quality family friend and neighbor provider. They might be comparing their grandmother to a really crappy center. And then what's the right answer, right? A loving grandmother or a crappy center? So I think that we're just kind of not thinking carefully enough sometimes in this debate. And I think that COVID may actually provide a window to really break open this discussion a little bit. There are lots of things that family home-based childcare does extremely well. It's a good place to have a mixed age environment as opposed to having classrooms that are all the same age, and there's benefits to having mixed age as well as same age. And so it's a more intimate setting. If you need evening care or weekend care, it might be a more promising setting than some centers. So at any rate, I think that home versus center argument goes well beyond COVID. And I think I'd like to look at our data to see whether homes are responding differently than centers are to the pandemic, partly for that reason. And then I just want to say, and I'll be quiet, that in case there's someone on the call who is a center early childhood developmental person, I'm not at all trying to say that I don't think we should be investing in public pre-K. I absolutely think we should be, and I think we should be developing really good centers. I just think it's a kind of, the argument is more complicated than it sometimes comes across. That was my
yeah. No, that was really, really helpful. Okay, I'm going to switch over to the Q&A, and there's also Michael Miesel has some questions in the chat that I hope we'll have a chance to get to, although we don't have too much time left, so let me get there. So David Innes asks, how will the $15 hour minimum wage proposal affect the infrastructure, the childcare and early education infrastructure? And then also just the recent executive order mandating $15 an hour for all federal contractors. Will it affect any of those programs?
Right. So the answer to 2, I would think, would be yes, if you're a federal contractor. And I don't know, I don't have a good enough sense of how, how many childcare programs are under federal contract, but there are probably some. But I think the question to 1 is really important because it gets at this, what I think it's the reason why we need public investment in the childcare sector, because it's that thing I said at the very beginning of my talk, that for parents, childcare costs too much. For providers, childcare doesn't pay enough. And parents can't pay enough to give providers sufficient wages, right? So we can't put the burden on parents to pay that. That doesn't mean I don't think there should be a $15 minimum wage. I actually think that might be a perfectly appropriate thing for the childcare industry. Many childcare providers are not going to be happy with it because they're operating on such low margins. But work needs to be dignified with a floor that is reasonable. And I think if that's what we're saying is the reasonable floor, then I don't think we should exclude the childcare market. But it's really complicated, and the answer for me is that's a perfect example of why we need. It's not a market good. It shouldn't be just a private market good.
Yeah. Okay. So Erna Danita asked, Julie, if I'm correct, you mentioned that states reimburse the providers at the lower rate than market price. You had mentioned that. And so she has a couple questions around that. Is it because of the nature of the block grant itself that gives states discretion for setting the rates? Do you find patterns of responses and adaptation to these financial pressures? Would this condition get even worse in the 12 states that decide not to expand Medicaid? Yeah. I'm not sure you can answer all 3 of those questions. Maybe you want to pick one.
Well, the first one is easy, so I'll answer that one. Before 2014, when the childcare subsidy law was reauthorized, it had been the same since 1996, and then it was reauthorized in 2014. Up until 2014, the federal law said that states should try to target 70% of market rate, but they didn't hold states to that. And I think only someone might know 2 or 3 states were at that level and no one else was. I mean, no, it wasn't happening. In the 2014 reauthorization, I believe states are now supposed to have a plan in place to get there, and maybe they're supposed to already be doing it. So the teeth of the 2014 law are a little, sharper. I don't have any patterns, Erna, right now about responses to adaptation because I haven't done the analysis carefully enough. But I'm very interested in looking at that exactly, like who's using what adaptation strategies and what might be explaining that. I think is interesting, and the heavy reliance on stimulus programs. I'm curious to see if that varies by professionalization of the program, size of the program, whether they have access to kind of resources to know how to use those programs, et cetera. And maybe for-profit, nonprofit is one of those interesting questions. I don't know the answer to 3, maybe yes. Would the condition get worse in 12 states that decide not to expand Medicaid? I don't know. I mean, I think I don't know enough about health policy, but it feels like if there's less government funding, if a state has less to use to support its low-income community, it's not going to be good, right? But I don't have a real answer to that question, to your number 3 at all.
Okay, I'm going to ask, I think it's 1:50. We're pretty much out of time. I might just try to squeak in one more with Michael Miesel has a number of interesting questions. Maybe the 2 of you could kind of communicate offline or online, but off Zoom. But his first one, I'll just launch his first one and maybe you can take a quick stab at that and then we'll have to bring it to a close. He asks, why are there non-strategic pathways to have an alignment between essential workers, essential childcare, and essential elder care? Kind of the way I read that question is, why hasn't there been a broad kind of political coalition to bring these groups together to really get some substantial changes? Hopefully I got the gist of that question in the right way.
Yeah, I don't have an answer. Gina Adams and I wrote a blog post, which I think is the only one I've ever done, at the very beginning of the pandemic, talking about childcare providers as essential workers. And I guess it was trying to get a little bit at that. And then the other part, bringing in elder care. Yes, I mean, I've been thinking a lot just in the last year about, there's so many really different things about the childcare market and the way in which we care for kids and the way in which we care for older adults. But it seems like we should be thinking across those. And I think there are some people that do that. I don't, and I would actually really like to. So Michael, I'm happy to chat. I don't see you anymore since I'm not at the building. But
yeah, you guys should chat. And there's another colleague, he's a historian. He just has a new book out. Winnett is his last name. Gabe Winnett, yeah. And he thinks more broadly about care work. And so I think that's one way to kind of conceptualize this coalition, right? Is that there's a broad coalition of people that are involved in care work. That might be another way to kind of think about that.
And that group, I'm on one of their listservs. That's a pretty active group. If they're also, most of them are sociologists, I think, that are on the care work listserv that I know of. But they do a lot of elder care and child care.
Yeah, kind of bringing that together. So for those of you in the audience that are interested in this, that's something to get involved in. So anyway, Julie, thank you so much. This was really interesting. I wish you luck in getting your 2 proposals funded, and wish you luck further analyzing these data and getting it out to the broader world.
Great. Thanks so much for inviting me and putting up with my very early results.
No, it was fantastic. And I'm sorry to all you in the audience that you had great questions and I wasn't able to get to all of you, but feel free, I hope I'm not saying this out of turn, to reach out to Julie separately.
Please do. Please do.
Okay. Thanks everybody. See you next week. Bye.